Approve the minutes from January 18, 2022.
A second. All in favor? Aye. They approve. The meeting is now open for public comment. If there's anybody in the audience or on queue, I don't see anybody on queue. No comments from the public. And we will ask Charlie Brown from the Health District if he would like to go with his Zoom presentation. Charlie,
Yep.
welcome.
Hi, guys. Thanks. Hopefully this is one of the last times I'll do this via Zoom. So right now, as far as 321, total number of COVID cases stands at 3,647. Total deaths within Rocky Hill stands at 145. Vaccination rates are actually really good in Rocky Hill at this point. The 65-year-olds are at 100%. Most of them have actually gotten their additional booster shots, and the rest of the folks, down to the 5 to 11s at 57% could use a little bit of boosting. But most of the people have actually done their vaccinations. Where Rocky Hill stands right now, as far as the state map with the color codes, we're actually in the yellow at 5.7, so 0.8 less, and we'll actually be in the gray with no alerts and no restrictions. Number of cases has continued to be declining at this point. We've seen a lot of cases all across the state have been going down. There's still some towns that are actually in the red, but for the most part at this point, we're continuing to go down. As we look into the future, there is some risk what we're seeing in Europe and China with a subvariant of the Omicron virus, the BA2 variant, of actually coming back and making cases increase a little bit. We're lag about 3 weeks behind Europe. So Europe right now is seeing a very big increase in number of cases due to this variant, where we're actually seeing, potentially for us to go up there. The good news about this is, while it's more contagious than Omicron, it's no more severe, and the vaccinations still work very well for it. With that, I'll stand ready to answer any questions.
Councilor Prakash?
Yeah, Charlie, a couple of quick things about this new variant, and do we know anything about its presence in the United States and its effects, or broader population?
Yeah, it actually is in the United States at this point. It's it's a little bit harder to pick up in the test than what Omicron is, but it is a variant of the Omicron variant, so it's a subvariant. We have seen it in in other states, notably New York and New Jersey, and right now I know Maine is seeing a high number of cases, kind of on the upper part of Maine, and they're probably dealing with this variant. Overall, as I said, it's not any more severe. So we're really looking at the numbers of hospitalizations now to kind of drive actions, and our hospitalizations are really actually very low. Today they had 5 additional hospitalizations statewide, and we're up to 97 across the state. Contrast that with back in January when we were at the peak of Omicron, and we were over 1,000 cases in the hospital. So as long as we can keep the hospitals functioning, hopefully this particular subvariant shouldn't cause us a lot of issues.
Great. Thank you, Charlie.
Charlie, I just don't know if you want to comment at all about any. I mean, it doesn't seem like the opioid crisis is hitting our area, but again, I've been asking about it. I want to make sure that we're not overlooking it, and also mental health resources for the district, or the status of those type of resources.
Yep. So I've gotten some information back on opioids as far as to date. So for Rocky Hill at this point, we're seeing up to 19 deaths from opioid overdoses. The majority of those are fentanyl related. And Rocky Hill is starting to see a little bit of an increase with the number of actual overdoses that are occurring within town. A lot of these overdoses, and I'll try to share my screen, and hopefully you guys can see this. A lot of these overdoses, are picking up along the Celestine Highway. Can y'all see this?
Yes.
Okay. So they're picking up along the Celestine Highway. Some of them we're actually seeing spread out into the community around that area. We've noticed that there's quite a bit on the town line area around 91 on the north side of the Celestine. And we think that there's, an issue in that area with some of the relocated homeless that were actually put in some of the hotels in that area. So we're actually seeing, a little bit more than we have in the past years in that area. As far as mental health and resources, I don't have any other information to provide. We had asked Department of Mental Health and Addiction Services about their overnight contracts, and we haven't gotten a definitive answer at this point as to when they're going to see more resources on that overnight shift. There is currently, I believe, up until about 5 or 6 o'clock in the evening, the ability to have mental health resources deployed. But the overnight, they just have not been able to find a contractor for it.
And I've forgotten what you said with regards to the United Way suicide hotline. Don't they have one?
Yeah, the United Way, if you can definitely call there for many resources, especially if you're in crisis. So they do have the ability to get you to proper counseling, things of that nature. We also have how we can help, with a recovery coach that's actually in our 4 towns, so that folks, if they're in crisis and they want assistance or they want to start on the path to recovery, we can actually assist them with finding the appropriate resources.
We have Melissa Hicks here tonight, and maybe we'll move up to the police report if you stay on. Not that the police report is going to focus on that, but we will have a factor in this area, so if you don't mind.
No, absolutely.
Thank you for your report. Next up, if we could jump to the police report, Chief Custer.
Okay. All right. For the month of February, we had 3,738 calls for service through the dispatch center for the month. Also for the month, we had 19 criminal arrests. We investigated 35 motor vehicle accidents, 33 of which were property related, 2 with injuries. We issued 42 infractions for the month, an additional 257 warnings, for a total of 299 motor vehicle stops for the month, 17 town tickets issued, and we had 87 training hours for February. In terms of staffing, we have 1 vacancy presently due to a retirement. We've vetted out a candidate, and he's completed his background, passed all phases, and he will be beginning with us on April 1st. So that will put us up to full staffing, both sworn and civilian personnel. In addition to that, we do have under staffing 1 dispatcher who is out on FMLA leave. Anticipated that she's going to be out through May, and that's all I have on that. In terms of other items, just an update on the license plate readers, LPR camera system that we recently contracted with. We met with personnel from RECOR, and basically spent 3/4 of a day going around town, identifying locations, critical locations, gateway locations, if you will, in town that would be, in our opinion, the most reasonable locations to mount these units. So they took in all the information and took photographs and did collection on their end, and now we're just waiting to hear back from them in terms of what the next step will be. So I'll keep you posted once I hear back from them at our next committee report. We continue to operate with the Greater Hartford Regional Auto Theft Task Force, and for the months of January and February, that unit made a total of 20 arrests related to stolen motor vehicles. In the last report that I received from them, they noted that they're starting to see a decline in the theft of motor vehicles. So I think the good work of the unit, collecting up the main players and getting them incarcerated, has really had an impact. So obviously we're going to keep the effort going, but it seems to have quieted down, at least from when the unit was first started.
I don't mean to interrupt, but you did mention just a minute ago you had a traffic report of 200. Did you say 259 or 257
257 warnings.
stops?
Yeah, stops.
And then given warnings.
Correct.
On top of 200 arrests for stolen vehicles in this auto area.
20 arrests.
20 arrests?
Yes.
20 arrests for stolen vehicles.
Correct.
On top of 359 stops on 91 by state Troop H, state troopers, in the month of February, 4 days, the 9th, the 10th, the 11th, and the 12th. That's almost 90 stops a day. All this occurred in the last 30 days.
Mm-hmm. Busy quarter. Extremely busy quarter. So, again, we're starting to see a decrease in the stolen motor vehicles. The catalytic converter thefts, however, continue. For the month of January and February combined, we had 48 catalytic converters stolen. Yeah, I recently saw same statistics from Glastonbury. They're almost identical. They had 50. So, we've talked about it. It's not just townwide, it's statewide. Allegedly, it's nationwide. So hopefully this new legislation might help curb some of the activity at the metal yards. But, my concern is that if we tighten up the law in Connecticut, they're just going to go to Providence or go to New York, But we'll see. Mm-hmm. We'll see. But those continue to be a problem. And it's the same locations, generally industrial parks, nights, weekends, businesses, hotels, anywhere where there's a large, obviously, groups of cars. And then the only other thing I had to report is we were recently reviewing the town ordinances on our alarm systems, burglar alarms, fire alarms, so forth. And the language that we have on the books stems from 1997. So as you can imagine, it's pretty outdated. So we're going to be taking a look at those ordinances. There's 2 of them. A lot of what's in there now doesn't even apply, and then some new things should probably be updated. So I'm going to probably be coming back to you next month with a proposal to clean up those ordinances, and then we can discuss what the process would be. But it's just housekeeping more than anything. Just
okay.
Hasn't been looked at since 1997. And that's all I have.
Councilor Prakash?
Yeah, Chief, we did started a higher baseline this year with the thefts from motor vehicles. Like, if you look at the first 2 data points, they're much higher, right? And then the December was higher too, actually, if you look at the yellow line. And so I'm just wondering, it is significantly higher, actually, right? I mean, if you look at the last 3 years, they always started like similar points. And then these these last 2 months have been like substantially higher as the baseline.
These catalytic converter thefts are driving at.
Okay.
Yeah,
Yeah, I was like, there must be some underlying cost.
that's what it is. Yep. So, we'll continue track of it. 48 in 2 months is a lot.
Yeah.
That's a lot.
That's a lot, right? Yeah, that's what I thought. Like that looks like substantially higher. But you're down to like one opening, right? Like you said, because of retirement now. You have somebody in the pipeline already for that.
Yes. Matter of fact, a Connecticut State Trooper lieutenant who
Nice.
just reached 20 years, put in his retirement, and passed all of the background. He's going to be a tremendous asset and a real good addition to the force. So we're looking forward to him coming on board April 1st.
And also, Chief, I want if you can talk a little bit about like how like the pension reform we did, or I should say bringing back the pension. How is that helping you in terms of retaining recruiting? I don't think we have touched on this topic in a while, so I'd love to hear your opinion about that.
It's had a tremendous positive impact, without question. Going back to that defined benefit 2 is what we call it now. It's a little different than the original pension, but still excellent pension nonetheless. There were, as you know, in some of our conversations months ago, some of our younger officers were contemplating leaving because of that. Happily, all are still here and have no intention of going anywhere now. And in our recruitment, it comes up quite often. The assignment of vehicles and the defined benefit pension, probably singularly, those are the 2 most important things for most candidates, for whatever reason. I mean, the pension I
Right.
get, the other thing, maybe it's the novelty of it, I'm not sure. But other chiefs have told me in discussions at our monthly meetings that they've actually lost candidates because of that. So it bodes well for us. I'll give you another example. We'll be full-staffed as of April 1st. Newington, just across the way, 13 openings.
13.
Yeah.
And he can't find candidates that are suitable. We have a list of candidates that we can go back to.
Yeah, and that's why I wanted to.
So the quality
yeah.
is, we're getting the quantity and the quality.
Yeah, anecdotally you hear about this, right? Like, so I wanted to see like how you felt about that, because it's been there for a little bit now, since last year, right?
Yes.
I don't remember the exact time we brought it back, but so that's really good news. And then I don't want to. Are we going to talk about mental health? Vis-a-vis like how we can deploy it with the police force. If I don't know, like
Yes, yeah, so we have Melissa Hicks here from Human Services, and if you would be kind enough to take the podium, we're just having a little discussion about that. We're not sure where we're going with it, but we want to keep it going.
Yeah, and that's why I thought like maybe you get us started and then we can bring in the chief for the conversation.
Sure, absolutely. I'd be happy to. So you want me to give you kind of an update?
Yes, please.
From our perspective?
Yes.
Okay. In Human Services, anybody that watches the news, reads the paper, understands that mental health is on the rise, every aspect of mental health. And I work very closely with most of the first responders and the groups in town to sort of address a lot of what we can address. We've talked a lot about our staffing issues, but really and truly it's across the board when it comes to the issues on mental health. And most of you have also heard me say and know in your own departments that when you're a first responder or a public service worker, for us, the pandemic is just sort of where we're beginning to ramp up, because doors are opening and masks are coming off for a lot of people, but that's when the doors are opening and we're seeing what has sort of transpired and a lot of decline in a lot of areas. And so the different umbrellas really in my department. So there's youth services, which is an umbrella. So Lori heads that up. And to give you an example, that's a lot of work within the school. So she does prevention, mostly with the youth. She runs the JRB, which is the Juvenile Review Board. And so we work closely with the SROs from the police department. We work closely with all of the schools. So truancy, that's stemming from depression and anxiety, issues in the household from disruption and things that had not been reported. So in layman terms, when children go to school or when adults are going to work, other people have eyes on. There's other people to talk to. So whether we're discussing senior population, adult population, or the children's population, that didn't occur for the most of the last 2 years. So people were suffering, declining, having a hard time. And so now that things are starting to open up, we are sort of inundated in every aspect. So in the housing, there is, as a matter of fact, we went to a training at just last week at Middletown Chamber of Commerce last Wednesday. And the woman who was running the training on hoarding kept using, it was a 2-hour training, and she probably said the word tsunami 15 times to describe what is coming when it comes to hoarding / evictions. Homelessness has skyrocketed. So I heard a lot of the report of from Charlie Brown about the hotels and the drug addiction and overdoses specifically. It all ties in. So in our department, we are seeing it in every aspect. We are in the schools having meetings with the administrators, with the SRO officers. We are out in the community literally banging on doors and picking children up, helping their parents walk through how to sort of deal with this, making referrals. We have made many calls, responded to many calls in the community regarding specific hoarding. So a lot of times either fire or police will go into a home. There is a concern for immediate safety, whether it be decline of an elderly member who has not had proper care and has been left to sort of decline, or the condition of the home, or any of those issues. So we are called in. A lot of calls from adult children that don't live right near here to check in, to get resources. Financial, which goes without saying for a lot of people that were unemployed. I mean, it sort of goes on and on. A lot of dual diagnosed stuff. So when we see like the drug addiction along with the mental health, it all falls within the same category. But for our department, it's every aspect of what we do. So we 1 minute could be dealing with homelessness and looking for rehab solutions, while we get a call about an elderly who has repeatedly called EMS services for a lift assist, but finds out that they're declining and living in deplorable conditions. And then we get a call from the school that our JRB case, the kids that are struggling to get to school have not shown up. And so that's sort of day to day, really. It always ebbs and flows, but it's just ebbing or flowing, but not up and down. It really is just everywhere. And it's all the other towns as well. I mean, we're all seeing the same. I know that all the first responders in town have all reported, and like we said, and I think Lieutenant Phelps reported a few months ago, he actually came into our office to kind of sit down and prompt conversation about how we could be proactive, because statistically, he handed me the paper and said, Melissa, this is the call volume with the percentages that are directly related to mental health. And so that's what
that's where I was going, because I wanted to kind of understand the phenomena here, right? How much of your calls now, Chief, are like going in that direction, like which are not really like, you know, public safety, criminal, you know, activity, like what a typical police work, right, will entail, as opposed to now, like, you know, actually being in the community and, you know, kind of helping that health aspect of the community, right? So I just wanted to like kind of look at that intersection, because we have been talking about in the council for last couple of, you know, meetings about what we can do to help, right? Mm-hmm. And the conversation always goes to, you know, we can provide resources, we can hire someone part-time or full-time, whatever that might be, but then there is this aspect of the kind of like a time fluidity to this, right, which can happen at 2 o'clock at night. And so like what is the best way of like where, you know, the police is actually responding to these calls, or
Well,
we don't have a person who can go with them, right? I mean,
the police do respond, and so does Human Services,
Yeah.
which is a misconception because we are out in the middle of the night. And certainly, look, fire and police are very respectable, and they're very competent to handle many of the situations. But we are responding. I am on call. I am responding on weekends and at nights for things in town, and we're a very small town. We all know each other very well. We work
Right.
very well together. We communicate very well. So we all trust each other's judgment, and a lot of times it can be handled on the phone. We bounce ideas or thoughts off each other, and sometimes it can wait till morning. But I think amongst the chiefs and some of the department heads that are involved in these situations, we all very much talk in the moment and afterward. And so we're lucky in that sense. We work very well together, but we are responding, which I'm not
No,
sure was
I'm
clear,
sure you are,
but
yeah.
for Human Services
Well,
perspective.
we're concerned because police chief has noted that, and I think we were at 10% of the calls, the gross calls coming in for service.
Yeah, I would say roughly. I mean, I could get exact.
Yep. I mean, there's an X percent are fire, and another percent are distress, emotional calls, whether they're suicide or otherwise.
Mm-hmm.
But they know, or there's a sense that you're overwhelmed in your department to respond.
We are overwhelmed, yes.
So how can we help? Actually, that's really the question, right? And how can we help in a way where we do it responsibly in terms of resources we provide, not just now, but looking at long term, right? That's really the dilemma here, right? I think we can provide like short term resources, but then how do we make sure that those resources are there over several years, right? And so just that, like, I think we are just trying to figure out what would be the best way to get to those resources, which can help you bring that,
Certainly.
yeah.
I wish there was a very black and white answer other than, and I'm not sure if Charlie Brown's still on. And I don't want to use the word frustrated.
Charlie
because
should still be on.
Is
Oh,
Charlie
I'm still on.
Okay. And certainly I'm not sure if you agree or disagree, but I know that we're all have been relatively frustrated, right? Not with a specific agency, but the lack of support, region-wise or whatnot, when it comes to, for instance, we're talking about this overnight. At this point, post-pandemic, the fact that our region, and I'm speaking for Central Connecticut, does not have an overnight. And when I say that, I'm speaking very broad terms. Housing shortage. There is rehab shortage beds. There is detox shortage beds. Any one of those things that we are all facing every day, there's a shortage everywhere. So how can we fix this is a sort of a global question. But on a specific level, and I'm certainly not going to speak for Chief, the staffing is beyond extreme issue for us. So our department right now consists of me as the director, Lori Stanzik, who heads up youth services. She's doing that solo for the youth services component. And we have a full-time admin. Our one part-time case manager is out on maternity leave, so we're hoping she will be back. We did discuss with the town manager and brought on a couple of contractual workers. So they're not employees. They are here to help specifically for our senior population when it comes to paperwork, processing Medicare. We do have two very nice women that joined us, or willing to help, I should say, on an hourly rate. One is from the town of Bloomfield, and the other is from the town of Manchester. And so we speak amongst the towns, and they know that we are in need of the services, and that helps take care of some of the overflow. And at this point, I've said it, and I'm very proud of my department because we step up to the plate and do what needs to be done, like all of our departments do, all of us. But, to say we're not overwhelmed, when I referenced the training we went to last week, when they're using words like, a tsunami is coming, meaning the court system still haven't completely opened up. So when you think about 2 years worth of evictions, and I know, for instance, fire departments always kind of walked in sometimes to hoarding situations, but I can tell you from my perspective, the percentages of calls that they get now when they see inside the door for their safety, for the number of calls to say, Melissa, you've got to follow up with this. I mean, statistically, and correct me if I'm wrong, Chief, but that's my feeling based on the calls I'm getting.
Sure. We want to have a frank discussion. I mean, not to put everybody on the spot, but Charlie, I mean, you're our health department. We don't have one, and we want to, we have one. You're it, and along with these other departments that are here, and we just, we want you to know that we're interested in this, and we're focused on this a little bit.
Yeah, and I will say, as Melissa said, the tsunami's coming, and we, as we're looking at this, there's some things I think we need to think about short term and long term. I mean, supporting everybody that's out there as first responders, as they're dealing with these things that come up, is a short term issue. It's gonna happen for a long time. The need for prevention, the need for, services and programs that can help avert people from getting to that crisis point, I think is something definitely the towns should be considering at this point. What are the mental health programs that can be put in place that assist citizens in dealing with the situation or finding the appropriate resources before they get to that crisis point? These are things as we look at recovery from this pandemic that I think absolutely need to be considered. And, we're working with all of our social service groups on the opioid things. This gets even beyond that. And we haven't really started talking a lot about, what mental public health recovery looks like post-pandemic. But it is something that, we do need to start, thinking about and start figuring out what the appropriate programs are to deal with.
So, Charlie, sorry, didn't mean to cut you off, but there are two things here, right? One is more of a strategic vision, which you are talking about, and we should keep an eye on that. But then there's a tactical need here, right? Which is more to do with Melissa and the chiefs here, right? So I'm just trying to figure out, like, how can we solve that tactical, problem first, and definitely keeping in mind the strategic, objective here, right? And if there is a model, like if there is a model we can use, if any other towns are using for that tactical solution, as opposed to
I mean, from what I hear with Melissa, they're responding appropriately as they can. I mean, additional resources and having additional personnel to be able to respond, and ease some of that burden as they go through. I've advocated, a couple times, and Melissa may hurt me when I say this, for more funding for social services. It's absolutely necessary that they have the people on the ground that can deploy in those circumstances. And it can't always be, Melissa or Lori, because eventually they're going to burn out, especially as this tsunami hits. There's only so many of them, and they're going to get stretched and stretched and stretched.
Well,
so
Charlie, I'm just thinking along the lines of Councilor Prakash here. I mean, if we're looking at 10% of our calls in the mental health distress call coming into our dispatch, times the other towns in the same ballpark, and it seems, this is not my idea, it came out at one of the meetings, but I'm thinking that the health district would be the perfect place to house a response team or response resources where, as the calls come in, if they're mostly centered on the Berlin Turnpike or not, you can get around the district because the towns don't have health departments. I mean, I'm throwing that out there. I'm just trying to talk about it, and you seem like a central
I appreciate
spot.
that. I think that is something that we had brought up at a meeting, as far as looking, at some of the American Recovery Act funding on how to figure out how best to serve some of those needs from mental health, and crisis. I'm not sure we're the best place to house that, as far as dispatching and things of that nature, but I'm more than willing to be able to sit down with the four towns with the 4 departments and actually discuss what their needs are so that we can be able to try to find a solution for that. That's absolutely a role I'd be happy to fill.
Yeah, so we would want to start at least to know the number of calls that are coming in
Yep.
monthly for this need, and how many of them are falling into the, to the night hours and the wee hour, morning hours, and all that kind of thing that we have to respond to, because that then drives the tactical response.
So
I'm just making a note.
No, sorry, go ahead, Charlie.
No, just making a note. Go ahead.
No, I was just gonna say then it's mostly the conversation where it is right now, like from your point of view, Melissa, is like how we can like actually better staff, I guess. I mean, but then the question becomes like what that staffing level looks like and what the hours of that staffing looks like and all those other things. And that's where the chiefs come in as well, like in a way, because at some point, like, I know you attend to these calls, like you said, like, and there is a part of, this is a collaboration, but from that point of view, I think we need staffing at that level, at that time of the day as well, right? So there was some concern about like having a part-time person who will not be available at that point in night.
Oh, sure. Yeah.
Right. Something like, I mean, I'm just like,
No, I
this
agree with you.
operationally
And
better than I
I just
do.
want to clarify, there are
Yeah.
2 part-time positions on the town website that are up in order to help. I know speaking to other departments, I know they're having a hard time. People are not looking for part-time work. I mean, that's been up there since December. So it's been up for a solid 3 months.
Have you interviewed anyone?
Not one. I have not received one resume in 3 months. So, I mean, I think there's several attempts. I think we need to find a way to reach a bigger pool, because I know, speaking amongst my peers in the mental health, licensed therapists are 3 and 4 month wait lists, and anybody everywhere, you cannot call and get an intake with a therapist immediately. It does not happen. It's several months wait list. In-home therapy is several months. IOP programs, which are intensive outpatient, or PHP, partial hospitalization program, which is where you go a certain amount of days or a certain amount of hours per day after inpatient hospitalization is sort of a go-between. Several months wait to get into these programs. We have kids at the school waiting and waiting and waiting for programs. So that's already where mental health is at as far as the wait lists go.
And Charlie,
so hiring
we'd like
is
to
certainly
know that the state is aware of this.
Oh, well.
I mean, I don't know who's reporting
I
it.
can't speak for the state, but I can tell you it's across the board. So, I mean, it's not Rock Hill specific. I'm not painting that picture. So certainly staffing is, and I'm not going to downplay the need for that, because there is absolutely a need for staffing in our department. But beyond that, it's the, people looking for more full-time, and I think that needs to be looked at. As far as our budgeting and because regardless, and I agree with you, as far as, that gets a little complex on the overnight shift and how do we flex that. But, and I know peers in other towns are looking at the same thing. I know nationally, and there's been a lot of talk in this country about social work, pairing with police departments. And I think that's up and coming for these reasons. That's no secret to Chief Custer or I. We get a lot of emails and frequently when we, talk about it, we both agree that is up and coming. There's big trainings going on. But I think that's the other thing. I think training for staffing in all the departments to sort of understand and combat sort of what is going on, what to look for, what are the most effective treatments, modalities to sort of tackle and use, because they're not the same as they were 2 years ago when people were not afraid to go out in public or hadn't been isolated for 2 or 3 years or hadn't ever been to school if they're young, and that's all brand new now at a different developmental stage. So there's a lot.
That is an interesting question you brought up, though, right? This is a really fascinating discussion, like from a policing and social work standpoint, right? So is there a paradigm where like that social worker actually is in the police department?
It is. Yes, it is up and coming. And more in the Midwest is sort of.
So is that something we should look at? I mean, so here's the thing. I'm thinking of whatever I know this is a state problem and there's a national problem, but whatever we can do here, right? Like, what we can solve for here is what we can solve for here. So I'm just thinking, again, going back to that tactical aspect of this, if that is a conversation we want to have, then maybe we should move in that direction from that point of view, right? From a complexity point of view, maybe that solves the problem a little bit more to the core, right?
Yeah, I think we're halfway there, and I'll tell you why. Just because, for instance, using Weathersfield as an example, Weathersfield has no licensed therapists. They send all of their mental health out into community providers. They don't offer that. Both Lori and I do that. And so I agree with you, and it's very interesting. I mean, they certainly haven't ironed all of it out. It's a new sort of idea that's up and coming in the Midwest and sort of slowly moving because of the mental health crisis across the globe, really, but certainly nationally. But because we respond so well here and work so well together, Rocky Hill does respond, and the PD can utilize, and it goes both ways. We often will call PD for assistance in these situations and vice versa. So I agree with you in that sense, but I will say that Rocky Hill is definitely more advanced toward that concept than many of the other towns that don't offer services or have that level of, lack of a better way of saying, expertise, that they don't do the specific mental health. And we do here in town and have provided that for many years. So that gives us an advantage. Let me put it to you that way. At least we're already in that mindset of working together and sort of pairing up. Now, not as specifically as that model says, as far as housing a specific mental health worker or social worker that pairs up. I think more, and correct me if I'm wrong, Chief, but I think their model is more a social worker ride along. And a lot of that was paired with some of the adversity that law enforcement came up against a few years ago and the mental health. It was sort of a clash in that sense. So, it was utilizing social workers and mental health workers to help diffuse situations or de-escalate to avoid some of the violent situations. And certainly, again, brand new concept, but not all of it is worked out the way they thought it would, and it hasn't quite migrated this way yet. But I know the Midwest is starting to look at some models.
I mean, definitely, I'm open to looking at any model that it makes sense and you guys can work with, because operationally you have to work with it, right? I might like it theoretically, or I might go and read like 3 papers on it, but eventually it's, you guys are in the trenches, so it should work for you, whatever that model is. I'm open to supporting anything that works for you guys. Definitely in the short term, tactically, and then in the long term, we can have a longer conversation, like which Charlie was talking about. So I guess. Where we are now is that, I guess I would look for guidance from you. I'm like I said, I'm open to I am fascinated by this model, like which we talked about, having like a mental health person or a social worker in the PD. I don't know if you can look at like experiences from like the Midwest, like you were saying, and see like what are the pitfalls there. And I'm sure, like Chief, you talk to people in your fraternity, right? So, like I said, I'm open to like whatever helps.
Yeah.
Yeah.
I think keeping our options open and definitely looking at that. And I know Chief Custer and I have said, like, it's interesting to see, and we will send each other the emails if they come out historically about, read this one or read that one. There hasn't been much that I have received since the pandemic started. It was really a push more with some of the law enforcement side of things a few years back before the pandemic kind of took hold, and then I haven't seen much since then. But I'm anticipating it's going to move in that direction because, again, we're looking at years to come that mental health is going to be in the forefront of a lot of our departments.
Well, thank you for entertaining this discussion.
Sure.
Kind of
My
impromptu, but we appreciate you coming out and would welcome you back to speak on this.
Absolutely, I'd be happy to.
Keep us updated on
Thank
it.
you much.
Thank you.
Moving on to fire.
Okay, thank you, Mr. Chairman. I'll go through the standard report here. Incidents responded to was 42, brings a year-to-date of 103 up till March 1st. February and March tend to be our slower months. Training hours were 369, brought us up to 669, which is considerably higher than February 2021. but we were in the middle of the pandemic back then. 1 injury to report. 70 members, 63 active. That number has moved a little bit since the report was written, with one member, one of the FMLAs, retiring. So the total drops to 69 with 63 active. Under facilities, apparatus, and supply, we had our annual Hearst tool inspections completed, and we got some quotes for the battery-operated extrication tools. We're moving towards battery-operated extrication tools for a couple of reasons. Number one, they're more powerful than the hydraulic tools nowadays. They're also less bulky. You're not tethered to a hydraulic pump and a gas motor. More portable. You're not dragging the lines in, and a lot lighter. We received a couple of quotes for new e-tools, as we have several hydraulic tools which came up in the inspection as either being obsolete or unsupportable. So if something happens to them, they're done. They're paperweights at that point. Let's see. Our fire department Facebook page is back active. Now we have a presence on Facebook, Twitter, and Instagram, which is real important from a recruiting standpoint. We had 3 members in the pipeline in February, and all but one are on the line right now, and we're waiting for one more piece of paperwork to get the third party back on the line. None of these members, one of them came certified with Fire 1 and Fire 2. The other 2 did not, so it is a process to bring them up to certification, and also some experience so they can work safely within the team environment. Just a couple other things in regards to Jim Lamar. I want to thank you for the moment of silence. And I'd also like to thank the council for all their support during the past 2 weeks with the services for Jim. But along those lines, I also like to thank the town manager, the emergency management director, the police chief, and there's just so many more people who were involved and extended themselves and really supported us, and we appreciate everything. Thank you letters are going out. Past 6 months have been difficult, but we're going to power through it. We have a great staff of dedicated people, but I think Jim's illness is an example of the hidden dangers of firefighting. So again, much appreciation with all the support. Close up a couple loops here. As for our COVID response, all our restrictions have been removed with the exception of a few mask requirements which are vaccination status dependent. Okay, so we are still monitoring that, and it seems to be working well for us. We have nobody out with COVID and haven't now for probably 6-8 weeks. Last time we were here in January, I spoke about daytime incident response, and I'm getting very concerned about some of the daytime responses. I talked about looking into per diem employees to help us out. That's only going to work on very limited, on a very limited basis, thanks to the Federal Labor Standard Act, or Standard Labor Act. So we've had discussions with the town garage, who have two of our department members are their full-time employees. We have a vacant mechanics job now. The job descriptions will require firefighter certifications. So between the town garage and once we get up to full staff, we'll have 4 certified firefighters going out to calls during the day from 7 to 3. So that's going to help. We're going to continue to watch it and report on this periodically. And last thing I have is I mentioned recently about our, we partnered with Osha to review policies and procedures in the facilities. We received 2 sets of recommendations, one safety-based and one health-based. We've completed our safety-based recommendations, which include a department structure plan, looking at training, different ways of documenting, and a couple other things. So that's been sent in. We haven't heard anything back from OSHA. Our health recommendations are not due for several more weeks, so we hope to have them in by the end of next week, and I will definitely follow up on that with the committee. And that's what.
Councilor Prakash, any questions?
Thank you, Chief. Quickly on that daytime response aspect of this, again, like if you want to elaborate on that a little bit, how that continues to be a struggle.
Absolutely. I'm becoming very concerned. Daytime response now, we can count on anywhere from 8 to 12 members. During COVID, and we were a little spoiled during the pandemic, with so many people working home, our daytime response was at least double that. Now that a lot of people are back to work, and also there's a lot of positions out there, so we don't have the depth that we did several years ago. So we're trying to get creative in filling that void, discussing things with the town garage. Joe Lentini's been incredibly helpful. And between that and a little restructuring with our own daytime people, I think we're going to hit the minimum. And the minimum for a structure fire is 12 people, excluding commanders. So hopefully we're going to hit that minimum. It's still a work in progress. We have the vacancies with the fire department's full-time staff, so we are working on that, and hopefully the job announcement will go out this week, and we'll start moving on that.
And that social media presence hopefully helps, right?
I really hope it does, and you know, along those lines, the call volume's not going down. It's really not. And I don't see it going down as the town progresses. I just, I see us increasing every year by a few %, and it's just gonna keep on going up.
Yeah. Thank you, Chief.
Okay, thank you.
Chief, are you comfortable with I guess the legislature right now is reviewing a little bit? I mean, not comfortable, but I mean, it seems to like it's moving along the potential for some legislation regarding our 91 corridor responses and possible, stipends to go along with that.
Yes, and I need to thank everybody for all the hard work, and I apologize for not mentioning that earlier. That is very generous, some of the numbers coming out of there. I hope it continues. That'll be extremely helpful for us. I know there was a little interpretation difficulties with the way the language was in the law or in the ordinance at that point, or the House bill. But if that goes through, I really think you're gonna see a big difference. And you can see we're still going out on the highway quite often. We're still, our numbers are still way up there with the highway, and they're becoming, as the state told us, the severity of the incidents is increasing because they're more related to high speed. Recently on last Sunday morning, the incident we went to, we could consider 2 incidents because the speed was so high, they hit each other. One car's in a guardrail and 600 feet away is the other one. So now you've got to dedicate apparatus to 2 blocks, 2 blocking setups, two incidents, each requiring a couple pieces of apparatus. one car's on fire, that creates a whole second set of issues. So that's what we're starting to experience up there.
Yep. And I know we were working on some logistics with DOT that might help their response time to the highway. I don't know if any of that got worked out.
I haven't seen much out of DOT. However, talking to some of the local fire chiefs, they've seen an increase in DOT's response time. So they seem a little happier with it, and maybe that first conversation was what we needed to really jumpstart some of this.
All right. Well, thanks. Thank you for your report. Moving on to the ambulance report. Oh, why don't we tie in emergency management here? I'm all over the place, but finish down the line, emergency management, and we'll come back to ambulance on the, you'll go final report.
Thank you, Mr. Chair. My report actually encompasses 2 months of details for January and February. So just a COVID update, as Charlie stated, we've come out, we're in the yellow, we're in the neutral zone right now, which is great. Some of the things that we've done around Town Hall with thanks to HR and the facilities departments, we've changed all the required signs to say recommended to wear masks. So we've had that out there. The town manager has gone ahead and changed the mask requirement to reflect that as well. There is a part in there that gives discretionary clause to local businesses, whether they want to institute that policy on their own. So it did give some flexibility. Again, I just want to thank all the departments for all the help back in January when we did those distribution plants. And again, very quickly, we saw how we went through product. In 20 minutes on the January 22nd distribution, in 20 minutes we went through 1,100 self-test kits and 5,000 masks. Those are big quantity numbers to move through in such a short period of time. So thank you to all those departments that assisted. Down in the middle of the report, we talk a little bit about the statuses of some of the projects that we're working on, and weekly emergency update memo that was completed. Notification system, I think, is working well to department heads, chiefs, and town officials. Establishment of the quarterly meetings is still work in progress. The CERT team, where we're going to be looking at that to assist in not only community-based things, but also within some of the departments in town. We have a tabletop exercise coming up for the police department, for the CALIA accreditation. We have sheltering guidelines and emergency and non-emergency situations as far as the EOC is concerned. There'll be some memos coming out on that as to how we institute those programs. And then over the summer, we're going to be looking at an active shooter training session in conjunction with the Board of Education. As of the last month activities, and again, these are encompassing 2, we had 4 weather-related situations. We did open up the EOC officially for the nor'easter, and again, it was just myself in that the EOC operations, but we did man it for 8 hours so that in the event that it did blow up to be a full-blown nor'easter, we were able to disseminate information from there. And that's really all I have at this point. We had no localized emergencies over the past 2 months that required any type of response. So.
Councilor Prakash?
No questions at this time. Thank you.
Thank you.
I just want you to know, like for the tabletop and the active shooter, I would think that you would inform the mayor and and council and
I'll be
and
sending
maybe
out. Yeah, I'll be sending out an invite if you're
okay,
more than
an
welcome
invite so
to
we
attend.
could sit on that
Sure.
that. And you're comfortable. The board. We were mainly concerned with the Board of Ed communication link, and that's you've figured that out.
Yeah, I'm on their the direct mailing list at this point, so any emails that go out, I will receive immediately.
So you're acting as a parent.
I'm acting as a parent.
Okay.
Yes.
That how you put
And
you in
they've
the
actually,
system?
They've actually given me they will participate with giving text messages or anything of that nature that they receive. They'll pass along so that we can inform department heads and town officials.
Much appreciated on that front. Thank you. Jumping over to ambulance for the final report.
Thank you. For the month of February, we did a total of 305 calls, bringing us up to 717 for the year so far. We've had 3 canceled calls, 4 with no patient contacts, and we had 1 when we were canceled en route to the call. We'd had 11 lift assists, 18 people refused transport at this time. We had no cardiac arrests. We did have an up thing on the opioid calls. We had a 4 in the month, 2 suspected calls, and 2 people complaining of withdrawals, making a total of 4. We had 36 hours of training. We have no new members for the last month. We still have 3 people in EMT class. Our current member list is at 60. We have 35 riding members. We have 11 probationary members that are getting to be clear, almost ready to be cleared. We have 10 associate members, which are office workers and people that don't ride the ambulance. We have 3 on medical leave, and we have 1 on a military leave at this time. Other than that.
Councilor Prakash?
Yeah, Brian, so like we do these for the fire and the police and like, generally speaking, do you have any like logs of like what the typical response times are for your calls?
The response times? No, we don't keep the log time. We don't keep those. We keep those through the police department. Our times, I mean, yeah, they're on our run forms, but we don't have anything that we keep. We don't generate reports on the response times.
Okay. Is there a way to like?
The state regulates it when we sign on with the police department. We also sign on with CMed, and if we're in violation of any kind of times or anything, they notify us, and we go through the reasoning what the delays were or anything like that.
So there is no data you can share with this committee, like on an ongoing basis going forward, if that's possible?
Well, we could. I mean, we would just have to get the information from the police department and from the run forms. We would have to break it down to the response times for the calls.
How onerous is that for
What's
you?
that?
How onerous is that? How big a deal that is for you?
Well, it's a huge deal. Good, but it's if that's what you guys want, I have to get it through the guy that does our IT stuff to be able to generate the report for you guys.
Yeah, because I don't want to create more work for you, administrative work, obviously, but I mean, I'm cognizant of that. But I just want to make sure that we have some visibility into that,
Sure.
generally speaking. That's
No
all.
problem.
So I know, like, if it is easy enough and if you're
Yeah.
easy enough as in like reasonably easy enough.
Yeah,
then-
we can get those times, yes.
Yeah, that'll be great. And then the second question I had was just about what is the minimum requirement from the state for the members, like riding members, I guess? Because that will be the critical number probably, right? Or is it, because that 35, is it like just, you can go down to 25 or you can go down to like 20 or?
The state doesn't regulate how many, it all depends on our we have 35 people that ride. A lot of people ride extra shifts. They ride more than, they're required to ride 24 hours a month to keep their status as active riding members. But if they're not riding, other people ride extra shifts to make sure that the ambulance is up and running. On the weekends, especially now with the weather getting nice, we're trying to get a second ambulance on. We're just so busy, but, we haven't been able to fill 2 ambulances on the weekends for years. Just people have lives outside of,
For
they
sure.
don't want to tie up their weekends on volunteering. So, but we're getting.
No,
to
the only
point.
reason I was asking was I was just curious because I don't know like what the baseline for those numbers are. Like, is 35 good? Do we feel good about 35, or
I'd
do
be
we feel
honest
like,
with
hey, like,
And
we are
I-
hitting to that number where like we start feeling uncomfortable? That's all I'm saying.
No, I understand that. All I can tell you is in like the surrounding towns, they can't. In Weathersfield and Newington, they can't even get an ambulance on after midnight. They have to go to their contracted ambulance service to do it. so we're pretty much, we do have a good base, and we're still, we have an EMT class that's running now that we have 14 people in, and we have, between Weathersfield, Newington, and Rocky Hill, and we have like 3 or 4 people that will be probably joining from that also. So we do have a pretty good link on trying to get them in to ride with us.
Thank you.
Brian, can you break out like of your members, who's EMT or who's a paramedic? What's the difference?
Well, I'm a
How many paramedics do you have, or how many EMTs?
Well, I'm a paramedic, but in Rocky Hill, you can't work, I can't work as a paramedic. They're all EMTs.
They're all EMTs?
Yep, because even though I'm licensed as a paramedic, we can't perform that duty. Well, we don't have the equipment for us to do that. We contract for our paramedic services.
All right.
But
And do you respond to the, like a suicide call? You get called in on any of those? Mental distress calls?
We transport those an awful lot when the PD, the PD's there and they call us for an evaluation, and then either we take them to the hospital voluntarily, or if they need to go into the hospital on a peer, then we take them in and to get evaluated on a 48-hour hold.
How many do you think you've done in the last, well, since the first of the year?
Yeah, quite a bit. A lot of our calls are evaluations for psychiatric or some kind of issues where we
In support of PD?
Yes.
And fire?
Mhm.
And so we appreciate getting a written report. So I think we want to move along a
No problem.
continuum where you start to produce a report, and
Okay.
we'll walk before we run in terms of what you include on there. But anything that you can provide us, obviously, is great for us to have.
No problem.
Thank you. All right. We already did the Central Health District. Thank you for your report. We already did the Health District update. And we don't have any new business as far as I know, John, or other business? No. So a motion to adjourn.
Motion to adjourn. Mr.
Second.
Chairman. Thank you.
All right, we're adjourned. Good night.